Welcome to episode 6 of the Think Tank podcast, brought to you by the Digital Innovation Group at Providence Health. Think Tank is a supercharged brainstorming session between two leaders from different verticals to help us solve some of healthcare's biggest challenges. This is Kelly Stonelake. Thank you for joining us. Today, we will be discussing how we improve access for end users through digital services. Joining us today is Aaron Martin, Providence Health's Chief Digital Officer, and Madhur Aggarwal, who is the SVP for Digital Channels and Customer Experience at Pearson. Pearson creates world-class education and assessment tools, content, products, and services to help learners at every stage open doors to new experiences. Welcome, Aaron and Madhur, and thank you for joining us today.
Thanks, Kelly.
Looking forward to our discussion. Really excited to be here.
Yeah. So this is such an interesting topic. We're talking about digital access in a time where the norms and expectations for access on pretty much everything, from where I get my food to how I see my doctor to how I go to school and how I learn, all of that's changed. So I would love, just as a way to kick us off, can we jump in on a recap from you both on what's changed for your businesses since February, March, where we have coronavirus, we have BLM movement, we have so many things happening in the world that are really impacting all of us, but especially your industries. So we'd just love to hear what's been going on for you since then.
Yeah, sure. There's been a massive amount of change in healthcare. We were the first health system to serve a coronavirus patient up in Everett in January. And so we've been kind of in response mode now for, over 5 months. And it has been an incredible experience. And it's been an honor to, as somebody who's a technologist, to be even involved with helping kind of protect our patients and especially our caregivers, who are kind of the heroes of the year and probably the decade. And what was interesting is a lot of the technology that we had built over time was built specifically to serve a very relatively small population of patients before COVID, virtually and digitally, and give them digital access. And it was mainly focused around what I would call kind of low acuity care, which means something that you need, kind of taken care of that day. It's not something you're going to wait for, but it wasn't something severe. So it might be, do I have strep? Do I have the flu? I need to see a nurse practitioner or a physician, that kind of thing. And then what happened with COVID, when COVID hit, demand shot up about 30x day over day. And what we saw happen was, patients becoming very, very concerned as to whether or not they had COVID, a ton of worried well, and a ton of patients who actually did, were possible COVID patients. And so we had to build kind of retool the platform from, a platform that was kind of seeking to serve patients, seeking care for low acuity, kind of same day care, visits, to almost all the populations, a huge volume of populations, and then turning it around to kind of protecting the the very kind of scarce clinical resources we then had, and creating a triage process to give as many people access to a conversation as to whether or not they may have COVID, and then if they did self-assess using a bot that we deployed, we could give them a video visit and have them see a nurse practitioner who can then, diagnose them. And then if they were diagnosed, then we can monitor them at home scalably if they didn't need to be admitted into the hospital. And all of that happened within a matter of weeks, that deployment of that technology and that configuration of that technology. And then simultaneous to this, what COVID did to our industry was it not only showed many of the problematic features of the American healthcare industry. The first one being our lack of, generally digital adoption across the industry. Providence, has been working on this for 6 years, but, you saw this kind of rapid adoption of technology to serve patients remotely. But it also showed, our fundamental business model has a flaw in terms of we're paid on a fee-for-service basis to serve patients, kind of per sick event, if you will. And what we need to do is move to risk. But the third one is most important, which kind of came up, with respect to the Black Lives Matter movement, is the inequity in which, our patients have access to healthcare resources across the country. And you see this in the COVID fatality rates. Black Americans have a much higher rate, of succumbing to COVID than other racial groups. And that is not any particular feature of the epidemiology. It's a feature of the systematic bias that we have in healthcare. So it exposed a number of huge problems in healthcare. One of them being, kind of the systematic racism and bias in the American healthcare system.
Aaron, that is. I'm sitting here listening to you and going, first of all, my thought and my thanks to every healthcare worker who's been at the front lines for now 3 to 4 months to keep all of us safe. And I did not realize that Providence was the first to deal with the first COVID patient. So even more admiration for that. But there's something else you said that completely resonated with me around the spike, 30x. And while we've been at building digital capabilities, we weren't almost in some ways ready for the prime time, correct? In a lot of ways, if we are honest to ourselves. The way I would look at it is I would have said, hey, most of our population or target population from a traditional education system was born digital. They were born with cell phones. They were born with laptops, and they were ahead. We knew that, right? That our customers were ahead of where we were. But we never fathomed a world where in 24 to 48 hours, all of this will flip from, going from primarily analog to going primarily digital, correct? Or exclusively digital, in fact. So in that sense, I would say with that constraint, I wouldn't say digital learning, remote learning has done fairly well. Billions of people across the world have been able to at least get some form of synchronous and asynchronous learning. The school year, as we know it in any part of the world, is not lost per se, but that is the minimum we should be expecting. And I think what needs to happen in the moving forward is we actually need to strengthen our digital capabilities to a point where there can be true, to use the metaphor in retail, omni-channel learning that can take place. With digital tools, with online capabilities, with in-person capabilities, we actually need to learn from the retailers on how to achieve true omnichannel learning or hybrid learning as it's happening, and that's what a lot of people are scrambling with and for as we come to fall 2020, at least here in the US.
Awesome. Yeah. So I have been so looking forward to this conversation with you two for exactly the points you just laid out. I mean, healthcare and education are fascinating when it comes to that intersection between access and digital, because as we think about how the internet, it's been around for 20 years, it's changed a lot of industries. It really feels like that change and acceleration from my standpoint, from a consumer standpoint, has happened over the last, 3 to 5 years, and then the last 4 months in such a accelerated fashion. I'm 15 years out of college, and my experience going to college and my experience setting a doctor's appointment over my lifetime has generally been similar to that of my mom and my grandma, right? You show up to class, you have a relationship with a teacher, you make a doctor's appointment, your provider. But now, as I see in the news of how kids are getting their, school-age kids are getting access to their curriculum, my experience in connecting with my doctor, with my therapist virtually, suddenly it's so different. And I would love to hear more from you about where you think we're at on this digital acceleration curve. Are we living in the future yet, or is this just the beginning.
Yeah, Kelly, I'm happy to start. You talk about graduating from college 15 years ago. I graduated a lot longer than that, and in some ways you can make the case that it has not changed. Though in all fairness, I would say it has changed. Right? When I went to college, there was still this notion of, as an example of textbook, the physical textbook, and now. As an example, all of the courseware or a large part of the courseware is digital. In fact, Pearson announced last year that it was going to go digital first with its courseware. Part of it is the economics of that, but part of it is because the consumer behavior and expectation has evolved per se. But again, to the point, the changes weren't fundamental. Right? They were incremental.
Mm-hmm. Wait, so are you saying I should finally get rid of my shelves of college textbooks that I'm still hanging on to?
Absolutely. I think the future of 3-year edition cycles in terms of college textbooks is going away, and college textbooks or courseware material are going to be like software in the cloud, which are going to be updated on a frequent basis. Absolutely, correct. So absolutely that is going to happen. Though I may still love my physical books, but that's a choice that you can make. But to your point about the future, the new normal, I do think we are going to go to a hybrid world, and I think that's going to happen in two forms. From a traditional education system, the education system that happens in the first 2 decades of your life. Right. And different countries call it differently. In the US, we call it K-12 and the US higher education system. That will still, there's going to be continued value of the in-person experience. And that is not purely from a learning perspective. That is from a growing up perspective, because the community that makes that up absolutely is as important as the classroom experience. But I think the fundamental shift that has happened is the notion of learning being confined to the 2 decades of your life has gone to a life of learning, or lifelong learning, as we say. So now you are more likely to be learning in your 20s and 30s and 40s and 50s, because if you think of a 100-year life per se, and that is more and more going to be digital first, digital exclusive. Think of things as micro-credential. Think of you're doing this from an employability perspective, and that is going to be much more just in time in the evenings, on the weekends. And that model is going to be, at least in my mind, digital first. And that is something that we have to raise as a society, as education ecosystem, to achieve that. I'm definitely curious how Aaron thinks about it from a healthcare space perspective, because new models are coming from what I hear.
Yeah, it's interesting. When you talk to our CEO, Rod Hochman, he talks about, the 3 industries who are kind of on the, kind of the back end of digital adoption, or healthcare, education, and the government. And there's a whole bunch of different reasons why I think all 3 have been kind of laggards in kind of, adopting digital technology. For healthcare, it is a very complex, large industry, and that is very, very, for good reason, highly regulated, right? And so that's been kind of, a big part of it. But I think what, COVID has really done is demonstrate that if you change a couple of, key variables, things can happen pretty fast. And so when, people, I had a conversation with somebody the other day, and, we were talking about this, and I said, well, if a year ago you told me that, if you had asked me what is the thing that would cause massive digital adoption within, in our primary care networks and in the way that we serve patients fundamentally, I would, 2 things I would tell you is we would have to shut down the clinics and get paid the same. And those 2 things happened during COVID, right? I mean, we had, all of a sudden the government and payers, because of the crisis, being willing to, pay the exact same for a virtual visit as they did an in-person visit. So that was one big variable. And then we had to shut down the clinics because of lack of PPE, right? So there was a lot of concern around, infection, and we also just didn't have enough masks to serve these patients outside of. We barely had enough to serve them within, kind of the hospital environment, and much less the clinical environment. So, so those were, not surprisingly, we had this huge kind of uptake. The big issue for us is going to be making sure, as an industry, that we follow through, because our fear is that we'll backslide, right? And my personal fear is also, in addition to that, because most of, and I'd be interested to hear your take on this, Madhur, is we've also served up all of our patients to disruptors now through this entire process, because now, if you think about it, most health systems have very quickly assembled a virtual platform for their patients. It's kind of clunky from the patient's perspective. And it's definitely clunky from the provider's perspective. If we don't solve both of those issues very, very quickly, it's open season, for somebody who could come in and provide a much more kind of, streamlined, awesome kind of consumer experience as well as provider experience. And so, so our team, fortunately, has been working on that for the past 6 years. The platform that we built, that we use to kind of scale, a lot of the response to this is a platform called DexCare, and this will be our third spin out. We just hired the CEO, and while we were dealing with the response to COVID, we actually had to deploy another health system in the midst of that, and that was a very stressful time, because not only were we kind of fighting our own fire, but we were also, one of our neighbors said, "Hey, we need some help here too." And what we got to see was, a platform that was built by a group of, folks from kind of Amazon and Microsoft, built to scale, actually worked really, really well in that context. So I'm very optimistic that the industry can get there. We feel like we've got a pretty seamless experience right now for consumers. We're seeing kind of 90 NPS scores on the front end of that. So patients love the platform that we built. But I think for the entire industry, there's a danger that providers may just say, "Look, this is too hard. Now that the patients are kind of coming back, I'm having to kind of run 2, 3, 4 patients within an hour, and I'm just going to start asking them to kind of come back into clinic and instead of doing a virtual visit." And that will be a fundamental turnoff for patients who've enjoyed that experience. And then we're, as an industry, very open to a lot of really, really well-run big tech and small tech disruptors in the marketplace that could kind of come and take those patients.
Aaron, that's a great point that you bring up. And I at least noted two points that you highlighted. One was the fact that we shouldn't take a step back. And I totally agree with you in terms of, I think you used the word clunky platforms, assemble clunky platforms. You're absolutely right. As industries, if we don't develop platforms that are not only stable, but that have an awesome consumer grade experience, the likes of what people expect from those companies up in Seattle, correct, or in Silicon Valley, you're absolutely right. At the same time, I do feel that from a consumer behavior perspective, I do expect some consumer behavior to change. I equate almost like this to Instacart shopping during COVID. You allowed substitutes when you were actually doing Instacart shopping during COVID, and you were okay with that. Now, when COVID settles down, you may not be okay with that. So I do expect consumer behavior, and the key for us would be to understand what is, where the consumers are going back to their original habits versus where we are forcing them, or our constraints are forcing them to go back to their original habits. And they will be a lot less forgiving if we, due to our constraints, force them to go back and regress with all the convenience they have.
That is a really great point. It can't be like the flip side of it is we also can't, quote unquote, force people who thought virtual visits, in healthcare was suboptimal for their care, but they were doing it because of the concern around, the virus. So yeah, it's a very, very great point.
Yeah, let's talk more about that. Something I was thinking about as you both were speaking is we're talking about access, and my perspective has been, wow, look at the acceleration in access over the last several months. But the reality is, in your industry, is in most cases, people haven't actually been left with any other choice, right? It's expanded access, but kind of by necessity. The Instacart example, you still could make the choice to go to the grocery store, right? If you wanted to. My, kid's entire school moved online. There was no choice in that. My therapist only will meet online, no choice in that. And so I want to pivot and talk a little bit more broadly about why access matters for society, because as you both mentioned, there are a lot of players. There's this patient, there's the student, there's the educator, there's the doctor, and everyone kind of has to be on board. And so is this consumer led? Is this industry led? And can we talk a little bit about how it matters for society, why it matters for society? And then just broadly, what does that expanded access mean for healthcare? What does that expanded access mean for education?
Yeah, I'll start. This is something I think about a lot, especially with Providence's mission. We serve everyone, especially the poor and vulnerable, and that is central to our mission. And it's one of the reasons why I came here, and it's the reason why I would say most of my team came here from various different technology companies. Is you get up every morning on a Monday. Can't wait to hit the week, because you're gonna push the ball forward and do some good for some folks, and then you just kind of leave it on the field the entire week, and you're exhausted by about this time. It's not Friday, but it's feeling like it. And it's just a great kind of place to work from that point of view. I think one of the things that my team always thinks about is, in terms of lack of access and convenience, that hurts the poor and vulnerable way more than it does middle and upper income. And the reason is if you think about it, let's take, for instance, somebody who's, lower income, let's say a single mom, with a couple of kids. One of the kids, gets sick, has to be kind of taken into a clinic. She is basically got to take probably half that day off just to accommodate, our lack of access. She probably has to, travel quite a distance. She's, pre-COVID, she's exposing her child to, other sick children. Post-COVID, it's actually dangerous, right? For her and whoever might be living with her as well. And she's not out just the copay if she has insurance. She's also out the transportation. She's also out half the day's worth of wages. And it may not even be possible for her to take time off of work. And so I always think of, our patients who are in kind of that situation versus get online, spend 15 minutes, of quality time with a provider who is, available to you through video, and you avoid that entire situation. Versus somebody like me or, anybody else on this call, we generally have reasonable, bosses who will let us kind of take some time off to take care of our family. We're salaried. It doesn't hurt us, right? And even if we did have to take half a day off, we could afford it. So my team is very, very kind of, focused in terms of access on kind of trying to solve that problem for everybody.
Aaron, I think you hit the nail on the head with the mission piece. You talked about three industries that have lagged digital, but I would say they have led in mission. Healthcare, education, and public service have been the leaders in mission. And as someone who was not from the industry, I actually have come in here and I've realized one thing. It's easy to inject digital, as hard as it may seem, and into purpose-driven organizations, into mission-driven organizations. It's very hard to inject mission into organizations that are digitally native, even, correct, as these times are proving out to for all of us. So that is absolutely so true. But Kelly, to your point about access, when I came in here, I thought of access over a long period of time. So I thought of access for those lifelong learners. If we get to know those learners when they are in their traditional education system, we can serve them well over a life of learning over the next decade, the next 2 decades, the next 3 decades. So absolutely, we wanted to understand their data, think of them as from a consumer perspective about lifetime value, correct? And all of that stuff so that we can serve them better over time. But in COVID, that access, that ability to reach your end users directly has taken a very different meaning. I'll give you an example. In UK, where Pearson is headquartered, has a large presence overall, there were roughly 8 million people that were furloughed. And what we were able to do in 6 weeks was to able to create a portal called UK Learns, where we were able to put 400 plus courses for free with our education ecosystem partners around math, around data science, around programming, around dealing with stress, correct? All of the things that you do need in these times. And we were able to provide access of millions of pieces of worth of content to those people who need it. And access took a very different meaning, very timely meaning, correct? This is not talk in terms of decades or even months. It was a matter of days and weeks. And that is where access has taken a very different meaning. And your ability to engage directly with your end users allows these mission-based organizations to truly stand, achieve their mission in ways that they haven't been able to do previously overall.
That is so awesome. That is an incredible thing that you guys did.
Totally. And such a great point, Madhur, about it's easier to infuse digital into a mission-driven organization than to infuse mission into a digital-first organization. Hadn't thought about that, and I think that is so fascinating, and I want to explore that a little bit more right now. So to close out, the discussion I would love to have is actually more of a thought experiment between the two of you, and I'm totally putting you on the spot, but would love to see where you take this. So my question is, if you two were to partner and prioritize how you would help other mission-driven, mission-first organizations like healthcare, like education, like government, and otherwise, what do you think the biggest primary initiative would be that you would want to tackle together? And what would be your first steps in prioritizing action?
Well, that's a great question. I think there's a huge overlap between healthcare and education we're now seeing, I'm hearing anecdotal stories about just, around COVID, or just about basic things that, because we're so deep in the details of healthcare and how the epidemiology of COVID works, most people don't understand, and they're making assumptions that are false, that are causing the disease to spread. I mean, some of it is political, but some of it is just a lack of knowledge and understanding. I mean, the latest is that, if you breathe into a mask, you're somehow depriving yourself of oxygen, right? Or, kind of that's one example. But I also heard, in a conversation with a health system recently where they had, employees, getting together, and they thought because they knew each other and nobody was symptomatic, they weren't kind of vulnerable, right? And these are employees within a health system, so they should know better. So I think there's a huge effort that, health systems and the education infrastructure could kind of, partner on, and just around how COVID works, but more importantly around how health, how to become healthy, right? And then also in the clinical research area as well, I think there's, obviously a huge leverage point there. Those are two things that I can kind of highlight.
Yeah, and Kelly, I would say that's a great but a hard question, right? Because if you think deeply about it, at the end of the day, these organizations will have to do everything that is still true to their mission, right? If they move away from mission, then we've missed the mark on what we are trying to do. But what I can definitely say, from based on my experience, having spent lots of time in the tech industry and so on, are three things. First is, these organizations' mission is the foundation, but they need to become more consumer driven. I think they have much more of they need tech understood very well the difference between a customer and a consumer. And I think every mission organization, whether that is being in public service, healthcare, education, if they have more customer centricity, that will serve them well and allow them to scale their impact. The second thing is this notion of platforms that Aaron talked about. I think there is definitely a need for purpose-built platforms in our industries. Way too many times, Aaron and I and our peers deal with general purpose platforms and try to fit it into our context. And that reduces our agility, that reduces our speed and our ability to act quickly. And we are making heroic efforts during these times. And finally, from a health and education perspective, I think the notion of the notion of there is a trade-off between cost and quality, correct? That happens in education, that happens in healthcare. Somehow we actually need to bring that to the forefront, because many a times what I see is there is a outcry about the cost. Education is too expensive, healthcare is too expensive, or there's a talk about, we are not getting what we need. I would love for that to come together and have a meaningful discussion in these industries about the cost quality trade-off and what is required, correct, from that perspective. And that is a more fundamental discussion that we need to have as a society in the context of where we are and where we need to be moving forward.
I think, it's absolutely amazing, the parallels between the two industries, because it's, now that you said it, we're getting criticized for the exact same thing, and they're valid criticisms. Higher education is way too expensive, and so is, and Lord knows healthcare is. And how do we kind of innovate around that, but still become way more effective? And we're seeing kind of green shoots of progress in our industry, where one of our portfolio companies, Lyra, they have a behavioral health platform, and one of the things they've innovated around is that the traditional kind of therapeutic model of 8 sessions weekly. They've kind of disrupted that and said, well, we're going to do 5 sessions over that kind of same 8-week period, but we're going to intersperse it with a bunch of cognitive behavioral therapy that can be done completely digitally, which is an educational product at some level. It's a training product, a bunch of homework between those sessions. And they're doing 2 things. One is they're lowering the labor content, which makes the platform much more affordable. And then honestly, in healthcare, it also makes it possible, because we have such a dearth of behavioral health specialists to begin with. I mean, we can't even get them to the patient at this point. But more interestingly, they have done an amazing job, and it's an actually much more effective product at the end of the day. So they've seen way better results, through that kind of approach. So I think there's instances where you can start to see some improvement in healthcare, and I'm sure there's the same thing in education as well. Some of those innovations.
I totally agree, Aaron, with you. I think I love to have the discussion on the outcomes, correct, as a society, as a nation, because that is more important. I'm not saying that is more important. That is equally important as cost is, and our understanding of the interdependency of the two is absolutely critical to progress at society as large. And frankly, the bridging the gap between the haves and the have-nots.
Completely. Yeah. I mean, Aaron, the Lyra platform you mentioned is, on this podcast, I talk so much about how much I love my virtual therapy, which is through Lyra. And also I'm thinking about Zelf, which you've talked about, in several episodes here. And the notion that, medical providers can actually prescribe digital experiences, learnings, exercises to improve health, which also just feels really aligned with both what you, Madhur, and what you, Aaron, have been talking about in terms of what access means and what it could mean for society. But even bigger than that, it's really exciting to think about what happens when people like the two of you get together and start discussing these challenges, because there's so much opportunity to improve both through the convergence of your expertise. And I think our listeners are going to get a lot out of listening to this conversation. I sure did. And I want to thank both of you for joining us today. So Madhur, Aaron, thank you. Thank you for joining us.
Thank you, Kelly.
Thanks for having us.
You've been listening to the Think Tank podcast, brought to you by the Digital Innovation Group at Providence Health. If you've enjoyed this episode, please leave us a review or follow @ProvInnovation on Twitter for more discussion about how digital can inspire solutions to some of our biggest challenges. I'm your host, Kelly Stonelake. Until next time, take care.